medical aids. They say the lockdown has forced some patients to stay home and not earn any salaries. This means they're not able to pay their medical aid premiums. For more on this, we're joined by Kelly du Plessis from Rare Diseases. Kelly, a very good morning to you. Just tell us about Rare Diseases. What does the organization do?
Thank you very much for having me this morning. Rare Diseases as an organization makes sure that patients with rare diseases are able to access treatments and life-saving care for improved quality of life. And the situation as such is leaving us in a very, very dire, desperate situation.
What prompted this call to medical aids? Do medical aids treat such people differently?
So we've seen across the sector, across the economic, all businesses are doing what they can to assist their clients and members during this time. And the medical aids, some of them have said that members can use their medical savings account. But in our opinion, this is selection bias because the chronic illness patients and the rare disease patients don't have medical saving balances at this time of the year. Medical savings, those with medical savings balances are generally the very fit and healthy. So it's not really a conducive option for them. And as a result, we've got 49%, in a short survey we did over the weekend, 49% of our patients would battle to cover their premiums. And that will result in them obviously coming off their chronic medication. And the economic impact of that will be absolutely dire because these patients will need to be restabilized again at a later stage. And they will become a further burden onto the public healthcare system during this time that they have no access to cover.
49% is quite a huge section of the community. Which diseases are these that we're referring to, Kelly?
So I can give you some examples. Patients with cystic fibrosis, with myasthenia gravis, with lysosomal storage diseases. These are conditions that generally have a very high cost burden. It's not a case of, okay, we can lose our cover and still afford to pay for the treatments out of pocket, because these are treatments are thousands and thousands and thousands of rands a month, from anything between 20,000 rand to, in some patients, 400,000 rand a month. So losing their medical aid cover is simply not an option. And unfortunately, as the NGO sector hasn't really been assisted much in this economic reform that's taking place, the NGO sector has relatively been left out, making it very difficult for us as NGOs to access the necessary funding to help the vulnerable patients in this time. And also, because of the ban on events, we're not, that's generally speaking the way that the conventional way of fundraising. So we're very limited in what we can do from an NGO perspective in helping these patients.
So with so many medical aid companies, how do you hope to have a harmonized approach?
So we have, in the meantime, kickstarted a fund to try and assist these patients. But what we have done for a long-term solution is we have approached the Council for Medical Schemes, which is the regulator, and requested their consideration in using the medical aid reserves to cover these patients, because we know that all medical aids have a 25% mandatory reserve, and that those funds are set aside, in our opinion, for a rainy day. And if we look outside, it's raining.
Absolutely. So when are you hoping to get a response? Has there been any sort of positive response from the medical aids?
We have been informed that the healthcare funders groups are looking at it at the moment, and they are giving it the urgent review that it requires. But at this stage, we have not yet had any sort of formal indication whether or not we'll be successful. And today is the 23rd. We've got a week before these patients will lose their cover.
Scary prospect there. Hope to talk to you another time to find out about the outcome.
Thank you.
Thank you so much for your time.